Welcome, everyone. Thank you so much for coming out this evening to hopefully to enjoy this Institute for Value-Based Medicine program. My name is Jennifer Waters. I'm the Director of Professional Relations for the American Journal of Managed Care. We are one of about 70 brands under MGH Life Sciences, which is the only private, independently owned medical media company in North America. We're really excited to be doing this Institute for Value-Based Medicine program with university hospitals and especially the cinema program. I'd like to take this time to thank our supporters that have joined us today, Boehringer Ingelheim, Lilly, and Novo Nordisk. Please give them thank you and make sure you mingle with them throughout our networking session. You'll see here we do have a survey that we would love for you to fill out for this program. We will put this code up at the end of the program, and it is on your agendas too at your desk. So please feel free to give us feedback on these programs. We do about 12 across the country. So it's really important for us to know how you're feeling about these programs as we build them for the future. Before I invite Dr. Nealon, our chair, up, I would just like to point out that we do have an illustrator in the back of the room who will be drawing and depicting tonight's program. So please interact with him. He'll be going throughout and illustrating tonight's program. And now I'd like to introduce our chairperson for the evening and thank him very much for agreeing to do this program with us, Dr. Ian Nealon. Thank you.
All right, welcome everybody. It's really great to see everyone here. Thank you for coming out on your Thursday night to spend it with us. We really appreciate your support, your engagement, and your involvement in everything we do. So I'm your chair tonight, Ian Nealon. I'm the chair for preventive cardiology and also the director for cinema program here at Harrington Heart and Vascular Institute for University Hospitals. This is our third cinema symposium, and this is the first year that we're partnering with the AJMC to do this program. So I wanted to thank Jen and her whole team and staff, and I'll thank them again at the end for all their support that they've given us for this program. We have a fantastic panel of speakers for you tonight, coming from across the country, all the way from California to Boston and in between, and really excited to discuss obesity and care in 2024. And I'm sure you'll all gain a lot of insight and a lot of new information and a lot of different perspectives as well for tonight's program. The agenda tonight, after my introductory remarks, we'll have two speakers. First, they'll be talking about the clinical aspects of obesity care, and we'll start from pediatrics to adolescents and then move on to adults. We'll then have a networking reception where there'll be food and drinks and ability to network and schmooze and talk to other people and meet like-minded folks. And then we'll come back again for two more speaker sessions, one on policy and the perspective from the American Heart Association, as well as finishing up with payers and funding and how to pay for care in 2024. And at the end, then we'll do a panel discussion with our four panelists as well as two other individuals, the Chief of Cardiovascular Medicine at UH and also our pharmacy champion, and we'll talk about their perspectives as well. Before we move on to the topic for this evening, I just wanted to take a few moments to give you an update on our program, the Center for Integrated and Novel Approaches in Vascular Metabolic Disease, otherwise known as CINEMA. The CINEMA program, for those of you who do not know, is a patient-centered, team-based program for patients with type 2 diabetes and prediabetes at high cardiovascular risk. This is our CINEMA team. We've grown over the past 3+ years that we've been in business, and it really does take a village to take care of the patient population and be successful the way we've been. So before I move on, I just want to ask everyone here who's on the CINEMA team in the room just to stand up and be recognized. Please go ahead and stand. Most of them are over here. Thank you guys for everything you do. It really is an amazing team to be part of. And as you'll see, we've had great successes as a program. So just last year, 2023 to 24, we saw a 57% increase in new patient visits, 28% increase in established patient visits, and 24% increase in total referrals. That is a huge growth for a clinical program, that does what we do. We expanded our team. We added a second nurse navigator, a second dietitian, our first advanced practice provider, and we're actually adding a fifth clinician as well starting this summer. Because of that increased growth, we've actually increased our markets as well. We're moving out to the east side toward Lake, south toward Parma, as well as underserved areas such as Otis Moss in the Fairfax neighborhood in Cleveland. We've also been able to leverage our clinical success for research to gain new knowledge and to contribute new studies, new research out there to advance the health of patients with cardiometabolic disease. So for example, we published in the American Journal of Preventive Cardiology our 2-year results from cinema. We also recently published a very interesting novel investigator-initiated clinical trial on using continuous glucose monitoring for patients not taking insulin and showing the impact it can have on behavioral modification and risk factor modification. Also, this past year, we had 2 very interesting and important publications, one on the cardiovascular kidney metabolic health, presidential advisory for the American Heart Association, which essentially talks about the patient population and the care model that we provide in cinema, talking about it on a global scale and the impact that something like that can have. And then finally, we really do care about the environment and communities, and Dr. Raj Goplan, who's on the panel tonight, led this urban environment and cardiometabolic health review and circulation. We're also very engaged and committed to community outreach and education. So this year, we expanded our patient program offerings, including weekly education series on Zoom, a weekly TheraPand exercise class also on Zoom. We have quarterly lunch and learns where we bring in people like chefs or dietitians or different people from different walks of life to help teach patients in person, how to manage their health. And we do grocery store tours with Heinen's, which is really a big highlight, I think, and led by our dietitians and our nurses. We've also this year expanded our educational offerings not just to patients, but to providers and the lay public. We have a monthly cardiometabolic speaker series that's international in terms of its outreach and the speakers that we have. Over 1,500 registrants and an average 200 people per webinar. It's also important to note that although we're one program here in Ohio, that this is a growing phenomenon in the United States and globally of cardiometabolic care that's multidisciplinary and comprehensive. So we're very proud to be charter members with St. Luke's Mid-America Heart Institute of the Cardiometabolic Care Center Alliance. And Andrea Stefos is here tonight from the CMCA. You mind standing up and just being recognized? Thank you very much. This is an abstract that will be shown at the American Diabetes Association. I think I wasn't supposed to show it because maybe it's embargoed. But nonetheless, what you can see is that from the blue at baseline to the red at follow-up, there is a huge increase in guideline-directed medical therapy and a massive improvement in biometrics, risk factors. And really, this is about improving patient health. And this is just an example of like-minded programs across the country that are growing together and to work on this patient population and to improve care. So let's move on to the topic at hand tonight. We're going to talk about the latest and greatest on obesity treatment to reduce the risk for type 2 diabetes and cardiovascular disease. Now, just to set the ground rules and background, obesity is highly prevalent, as we all know, in the United States and globally. Ohio there on the map, which shows prevalence of obesity per state, is 35 to 40% prevalence, and there are many states that actually exceed that. Obesity today, in 2024, although this may change eventually, is currently classified by body mass index. You can see there that classes of overweight, class 1, 2, and 3 obesity is how we define and talk about obesity these days. Now, obesity is obviously a risk factor for cardiovascular disease, regardless of the presence of other metabolic abnormalities. You can see here that even having no metabolic abnormalities other than an elevated BMI increases the risk for coronary heart disease, cerebrovascular disease, and heart failure beyond those who are not living with obesity. Now, obesity treatment is extremely complex because it's a complex condition that requires multidisciplinary care, and it really does require multiple therapeutic modalities, and going from lifestyle modification to nutritional interventions, pharmacotherapy, endoscopic procedures, and surgery, all the while increasing in treatment intensity according to the increasing adiposity and health risks associated with that. And each one of those steps in the pyramid have a goal for percent weight loss, and not just percent weight loss, but health improvement with the weight loss. That's the real key to obesity treatment. And we have a lot of science behind obesity treatment, and unfortunately, there's been a gap in translating that science and implementing it in clinical practice. I was lucky to be part of this circulation article that is a scientific statement for the American Heart Association about implementing obesity science into practice. And you can see the pipeline there. There are many different inputs, but many gaps as well. And so to move the science of obesity from ideas and hypothesis generation to research to then implementation in the real world takes a lot of steps, and there are a lot of gaps that we need to fill. And I think that this quote from the statement is very important. Building obesity care around these principles requires substantial financial input and engagement from multiple stakeholders. Still, the rewards of lower mortality, long-term health cost savings, and improved quality of life warrant the investment. And that's why all of you here are here tonight, to really talk about how can we improve obesity care in 2024 and beyond. So I'd like to introduce the speakers now. Like I said, we have a fantastic panel. And I'm going to introduce everybody, and then we'll start with the first speaker. Now, so please bear with me. There's a little bit of a biography here. So Dr. Robert Lustig is Emeritus Professor of Pediatrics in the Division of Endocrinology and member of the Institute for Health Policy Studies at the University of California, San Francisco. He's a neuroendocrinologist with expertise in obesity, diabetes, metabolism, and nutrition. He's one of the leaders of the current anti-sugar movement that is changing the food industry, and has dedicated his retirement from clinical medicine to help fix the food supply any way he can to reduce human suffering and to salvage the environment by interacting with all stakeholders to bring them together around a common vision of metabolic health: protect the liver, feed the gut, and support the brain. Dr. Lustig graduated from MIT in 1976 and received his MD from Cornell University Medical College in 1980. He also received his master's studies in law degree at University of California Hastings College in 2013. And he's the author of many popular books that you may have seen: Fat Chance in 2012, Hacking of the American Mind in 2017, and Metabolical in 2021. And he's the Chief Science Officer of the nonprofit Eat Real and is a member of the Nutrition Task Force of the American Dental Association. So welcome, Dr. Lustig. Our next speaker is Dr. Jamie Ard. Dr. Ard is professor in the Department of Epidemiology and Prevention and vice dean for clinical research at Wake Forest School of Medicine in Winston-Salem, North Carolina. He's also co-director of the Advocate Health Wake Forest Baptist Weight Management Center, and he directs medical weight management programs. Dr. Ard completed all of his medical training at Duke University, and he conducts research on clinical management of obesity and strategies to improve treatment outcomes in underserved and underrepresented populations. He has served on several expert panels and guideline committees, including the 2013 joint guideline on treatment of overweight and obesity in adults. Dr. Ard is also currently serving as the president of the Obesity Society. So welcome, Dr. Ard. Our next speaker after the break will be Dr. Melanie Phillips. She's an experienced leader in health policy and advocacy who's passionate about promoting health and well-being for all people through transforming the healthcare payment and delivery system and rethinking how we look at health. Dr. Phelps currently serves as Senior Advocacy Advisor, Health System Transformation for the American Heart Association. She's based in North Carolina as well, and is focusing her efforts on elevating the consumer patient perspective in alternative care delivery and payment models. So a very welcome and interesting perspective on policy from Dr. Phelps. Welcome, Dr. Phelps. And finally, our last speaker tonight will be Dr. Jeff Levin-Schurz, who's a managing director of the Population Health Leader of WTW Health and Benefits North America. He's a strategist for large companies across many industries and develops intellectual capital on healthcare delivery, medical management programs, and health policy. He has written and spoken widely on health policy, especially around adoption of disruptive innovation, and uses behavioral economics. Dr. Levin-Schurz has been published widely, including in Harvard Business Review, JAMA, Stat News, and Human Resources Executive. He previously served as Chief Medical Officer in multiple healthcare delivery organizations, including One Medical and at Tufts Health Medical Plan. He's an assistant professor at the Harvard Chan School of Public Health and at Harvard Medical School, and he received his medical degree from Boston University School of Medicine and his MBA at Columbia Business School. So also a very important and welcome perspective on payment and coverage. Thank you, Dr. Levenshurst, for being here. Okay, so without further ado, I'd like to invite up Dr. Lustig for the first talk, and enjoy.